welcome everyone to another episode of Talk with a Doc. My name is Janvi, and throughout this series I will be talking to doctors of different specialities and those at different stages of their medical journeys to learn more about the variety of opportunities within medicine. In today's episode of Talk with a Doc, I'm going to be talking to Dr Emma Poynton-Smith, a junior doctor working in Lincoln. It is great to see you again, Emma, and thank you so much for sparing some time to talk with me today.
Thanks for having me.
Thank you. So to begin with, I just wanted to know that I know that you went through graduate entry medicine, and so I just really wanted to know that did you always knew you wanted to study medicine and wanted to do a prior course, or was it something that happened as per the situation at the time?
I definitely didn't always know I wanted to do medicine. I started out, I didn't really know what I wanted to do at school. I just picked all the A levels I found interesting. So I ended up doing a bit of a mix of things. I did German AS level, then I did like classical civilization, history, maths, and psychology for like A2. And after that, I decided that I liked health as a concept, and so I went into psychology. And it was while I was doing my psychology undergraduate degree that I got part-time job doing care work. And it was looking after, various people with various different conditions. And I think the main thing that I found is that I always wanted to know more about the conditions that they had and how it affected them. And I wanted to know more about it. And the reason I got into psychology is I was interested in mental health. And I think over time I just realized that I'm just interested in health generally, more holistically, so mind, body, all of that. And it just kind of happened naturally. And so once I knew that graduate entry medicine was an option that existed, that's when I started thinking about it. But definitely when I was younger, even if you'd suggested medicine to me, I don't think I'd have thought that I was the kind of person to go into medicine. I don't think I'd have thought that I had the capacity to do it, because everyone's got their own hang-ups about what they like. And I think there's definitely a perception that doctors are meant to be perfect and that they're meant to be good at everything and that they're meant to be all-knowing and somehow, not flawed as human beings.
It's a high
expectation. And I think, and I think it just felt unattainable. So if someone had said to me at school, would you want to study medicine? I'd go, oh no, that sounds too scary. I don't think I'm cut out for that. But actually, I think when I came at it from a different angle, it was different. And once I'd got more work experience as well, and I saw that actually doctors aren't always perfect, but it's working as a team and doing your best. That's what counts.
That's really inspirational. I didn't know that actually you took completely such a variety of A levels, something that's so different to how we're told. Like now I'm told that you have to definitely take chemistry and biology is a must, and then you do your simple sort of route into medicine, the sort of one that we're all told about for everyone who's applying. But your pathway was clearly much different to the typical route into medicine. So so after you did your psychology degree, how did you apply for graduate entry, and what was that experience like?
Well, okay, so actually I applied for the first time in my final year of psychology undergrad. So for lots of courses that you apply for graduate entry medicine, they expect you to have had a certain number of hours of work experience, usually involving patient contact.
Okay.
So fortunately, a lot of my care work did count towards those hours, because it's contact with patients. And I'd also done some sort of supervised work experience for classic stuff that you find where I'd done, a week following around the doctor on wards and things like that. I'd managed, I think, 3 days of GP experience, and I'd done, what else have I done? Quite a few things. The other thing I've done is I had a voluntary role in the hospital library that I'd been doing for like a year or so at that point.
Okay.
So it was quite useful to have got that. It's not a lot of people who've done graduate entry medicine, instead what they've done is they've done a related degree, then they've done a year where they've just worked full-time in a care capacity.
Okay.
So they've worked as a healthcare assistant, or they've worked doing something in the hospital, something very relevant, which is not what I did. I kind of did bits and pieces of lots of different things. But my work experience was sufficient. the first year that I applied, I didn't get in. I got to interview. I only applied to Nottingham because I knew I wanted to stay there. That's where I'd done my undergrad, which in retrospect was probably not the best idea because I think I didn't have any sort of medicine interview experience.
Oh,
And
okay.
it was quite nerve-wracking, and I wish I had applied more broadly. And so for all of the courses that I wanted to do, well, all the ones that I could do without a biology and chemistry A level, which does limit your options for graduate entry medicine, you had to do the GAMSAT exam.
I've heard of that, yes.
Yeah, it has a bit of a reputation because it's sort of a 6-hour
Wow.
slog with 3 different parts, and that actually went surprisingly well. So I had a good score on that. My interview wasn't good enough to get into medicine the first year. So instead I applied to do a master's in my sort of year out, and I reapplied during the year of my master's. So my master's was in health psychology, which is also really relevant and really, so it all worked out for the best.
That's great. Great to hear. With your graduate entry, so you said that of course, you know, it was never from the onset medicine, but obviously you made it to graduate entry, and now of course you're a doctor. But do you ever think that if you had done the undergraduate route, the normal route into medicine, would that have advantaged you in any way? Because I know, for example, graduate entry into medicine is I think 5 years or 4 years in some places, and so it can be shorter. So did you feel that that was disadvantaging you, or did you feel that because you had so much background knowledge from your undergrad degree and your master's, it helped you more?
I think it depends what way you look at it. Because for me, coming out of a 3-year undergrad and a 1-year master's, the idea of doing a 5-year or even a 6-year undergraduate course in medicine was really daunting. I don't know if I would have committed to it. I don't know if I would have applied or wanted to, even if I was eligible to do the 5-year course. So the graduate entry medicine course in Nottingham is 4 years, and I was very glad that it was at the time. I have to say though, the way it's structured in Nottingham is the first year and a half in graduate entry medicine is equivalent to the first 2.5 years in undergraduate medicine.
Oh, wow.
And then you
join.
So the moment you sort of start your clinical phase, all of the students are combined, but you've done 1 year less than everyone else.
Right, okay.
But actually, I don't think it was a disadvantage. I think a lot of the things that they didn't do with us were the sort of general university modules, sort of how to do academic writing, how to submit course, you know, the sort of generic essay stuff that you'll get in most courses. And I was quite glad to not have to do that again.
Fair enough.
Because having already done that in my undergrad and masters, I didn't feel like I needed to go through it again. So we had fewer of those kinds of assignments. And generally, the perception in Nottingham, at least, is that the graduate entry students tend to be just as knowledgeable as the undergraduate students, and they tend to be more confident with their knowledge. I think possibly because we've got, you know, a few extra years and the previous experience, previous degrees, things like that. But I think the only possible area where I felt I was missing out is we didn't do dissection, and we didn't do as much anatomy in the graduate entry course as the undergraduates do. Again, that's different between different universities, but I do think that sometimes when anatomy questions come up, I'm still quite vague compared to my undergraduate counterparts. But I think the course structure did suit me, and I don't think I would have wanted to have spent an extra year doing the preclinical part of the course, because it is the clinical side of things that really interests me.
That's great to hear. I mean, at least, you know, you've made it to where you want to be now, which is amazing. And I think that it must have been quite a unique journey, but, you know, it's still amazing that you loved each part of that. That's great to hear. Looking now at your current position as an F1 doctor, do you think that, you know, are you enjoying working on the wards, and has COVID like shifted the way it would have been otherwise?
So COVID's definitely affected me. I was part of the COVID cohort, so I graduated early.
Okay.
I just started my elective in Australia when COVID hit, and so I had a 1.5 week elective instead of a 6-week elective. So elective, I don't know how much everyone knows about electives, but they're usually a 6-week or 8-week experience where medical students traditionally go abroad to experience medicine in other areas of the world, or they pick a specialty.
Is this before, sorry, is this before starting F1, F2, or is this?
Yeah, so it's
Okay.
usually right at the end. So it's traditionally, again, it varies a bit between different courses, but it will usually be after your final exams,
I see.
but
Okay.
before your graduation. So while they're marking your exams, you go off on a holiday, or you do a fairly specialist placement locally or in the UK or somewhere else if there's something specific that you want to do. So, for example, if I decided that my real interest was in gender identity, the gender clinic in Nottingham has a really good reputation, and so I might have tried to get some experience there. Or you can do what a lot of people do, and there's sort of charity schemes where you can go abroad and help out with things, even though you're not fully qualified. You're sort of recognised as having enough clinical experience to be useful.
Oh, okay.
And things like that. So there's a lot of people go to sort of exotic and exciting parts of the world to do things. I just went to Australia because I had the opportunity to go,
That's a
and
great point.
found it fun. I was doing psychiatry, which is something I'm interested in. And I did also want some nice weather for once. Not something we get a lot of here in the UK.
So were you able to go out as well, or did COVID completely?
Yeah, so I was there at the start of my trip. So I need to check the dates, but it was right at the start of March that I went. And at the start, I was aware of COVID. I was aware that it was a thing, but no one had quite recognised what it was going to be.
Oh, okay, yeah, of course.
And so I think it was the end of my first week, or around that time. It was sometime during my first week of placement. It was when they officially declared it a pandemic or an epidemic or whatever it was that they declared it to be. And I remember hearing that on the radio and thinking, this is going to interfere with my plans. And so the next week was when the hospital in Adelaide, where I was, cancelled all student placements. Anyone non-essential going into the hospital, they just put a blanket ban on it, which is very, very sensible. And so after that, when it became clear that getting home might be an issue, I got back fairly quickly. So I was only there for about 2 weeks, but it was fun. And in light of that, the university waived the need for you to have done an elective experience in order to graduate. And essentially it meant that for me, I graduated early, which was great. I didn't have to do my medical assistantship placement, which is another sort of traditional thing. It's kind of like shadowing a junior doctor right at the end of your medical course. Again, different universities do it kind of differently. But it was just, I hadn't been particularly enthused about the shadowing because I felt like I'd spent the last few years shadowing and I wanted to get involved. So then it was really nice because they came up with the interim foundation year 1 posts. I was able to start working as a junior doctor last May instead of waiting till August, which was
I see. So you start straight away then, pretty much.
Yeah, pretty much. So I graduated in April sometime, I think. Yes, April sometime, and then I went on to do my FIY1 starting in May, and it was so much more useful for me, at least, than the medical assistantship would have been.
I see.
And it meant that I had a bit more agency, a bit more independence, but I was still supported, which was a really nice balance for me.
Saying that you started early, how did you feel when, like, the first week or so when you were there as a junior doctor? Because you said, you missed out on your elective experience and your other placement experience. So, you were kind of fresh out of water in that sense. How was that like?
I think it was very encouraging that there were a few of us in the same boat. So I think there were 6 of us who started on the same day. We were in different departments or different wards, but we knew of each other, which really helped. And actually, I found it really protective having the role of interim year 1, like interim F1 doctor, so FIY1, because it meant that people didn't expect all the same things of me. So I was still expected to do, I was basically working 8 till 4 instead of 8 till 5, which was quite nice because they'd only contracted us for a certain number of hours. And also I didn't have to do any on-call shifts or any night shifts. There were no sort of 12.5-hour days. I wasn't really left on my own. I was theoretically meant to be sort of surplus to requirements. I mean, sometimes I was definitely needed, but it was quite nice to know that there were always going to be other people there. And the people who were there were the F1s who had at that point been there for 5 months on the same placement because they didn't move on. So the reaction to the pandemic for the F1 year above me is they didn't. So you're meant to have 3 4-month placements, but they did a 4-month placement and then an 8-month placement. So they really knew what they were doing. So when I turned up on the surgical ward, whenever I had a question, firstly, because I was interim F1, there'd usually be someone around to ask. And usually the person around to ask would be someone who'd been doing the job that I was now doing for the last 4 or 5 months.
The best person to learn.
Yeah, it was perfect. So I just, the moment I run across something that I didn't know how to do it, I'd just go, other F1s, how do you make this referral to this particular department? And they go, oh yeah, it's really weird. It's under S in the referral system. It should be under P. For some reason, they put it under S. And, you know, it would clear everything up immediately. Whereas they were the same sort of issues that a lot of the F1s found when they started in August, but there weren't as many people to ask because everyone was new. So because everyone changes round in the same sort of 4-month schedule, except the seniors who in surgery are often quite absent. They've got a bit of a reputation because they're in theatre. And so they just didn't have people to ask in the same way that I did. And so I think it was quite nice actually to start in a bit of a somewhere between final year medical student and junior doctor role, where I still felt like I was helping people and I had patients and I was looking after them and I was doing all of the jobs that I would be doing, but I wasn't left to my own devices on a night shift or dealing with sort of critically unwell patients without any support, which was actually perfect for me. It meant that by the time August did roll around and proper F1 began, I was already really confident. And it's just the little things that make you confident on placement, like knowing where things are. So because today is actually the day I've started my new placement on respiratory medicine. I've been having the opposite experience where I don't know where anything is on the respiratory ward because I know the surgical wards, I know the pediatric wards. I've been briefly on the respiratory wards on night shifts, but I've never actually sort of done everything there. And so I was asked to rewrite a patient's drug chart, the prescription chart earlier, and I realized I don't know where the new ones are kept. Like that. Whereas by the time when everyone else was brand new to F1 in August, if they were saying, oh, where's the form to add someone to the surgery waiting list, I'd go, oh, it's the pink form, 4th drawer down on the far right.
Because you know it.
I already knew where it was because I'd used it several times. And so that made me feel much more confident going in. And it was a kind of gradual thing because I didn't have to do those night shifts and those long on-call shifts immediately.
So no part of your medical journey has been the typical one, because of the entrance into medicine and also then because of the pandemic. So it's all been very, very different, and it's been such a exciting journey, I can see. Yeah, it definitely sounds really interesting to hear about as well. So now that you are an F1 doctor, so you've gone into the actual role of F1 doctor. What is it? I mean, how many different rotations have you already had?
So I'm now starting my final F1 rotation.
Oh, okay.
So I ended up doing a block where I did 7 months of general surgery. And then I did my normal 4 months of pediatrics. I've just finished, and now I'm starting my final 4 months in respiratory medicine. And then it's the same sort of format for next year. So for F2, I'll have another 4 months. So I start on, it's my first placement next year. I start on spinal surgery. And then I have my 4 months academic placement because I'm an academic foundation doctor. And then I have my 4 months on gastroenterology.
Okay, so do you get to choose which modules, as if there were, you do?
To an extent. So you pick them as a block of 6.
Oh, I see.
So when you're applying for your foundation program roles, there'll be lots of different options available to you, and you prioritize them. You state your preferences, but they all have certain things in common. So every block of 6, every foundation program will have a community placement. They will have a surgical placement, and they will have a sort of general medicine placements. So my respiratory or my gastro both count as those. So you can't do one that's all of one thing and none of another, if that makes sense. So you can't do all hospital medicine, you can't do all community medicine, you can't do all surgery, you can't do all medicine. It's they make sure that you get a kind of well-rounded experience.
Fair enough. But say, for example, you said you wanted to perhaps think about specializing in psychiatry. If you don't cover psychiatry as a rotation in your rotations over the 2 years, does that impact your later decision, or do you still have the opportunity to follow something that wasn't offered to you in the 2 years?
That's a very good question. It depends a lot on what it is. Generally speaking, as long as you've gone out of your way to demonstrate interest in an area and you clearly understand what the job involves, that's all that's required for you to apply for further training.
Okay.
However, there are ways that you can get this experience even if it wasn't part of your original choices. So my original lineup had trauma and orthopedic surgery instead of spinal surgery, but somebody who was doing spinal surgery wanted to swap, and because they're similar enough, we were allowed to swap. And so that's quite nice, because I thought that would be more interesting. It will be a bit more different to the general surgery, which I've already done. So if you were particularly interested in something and you're able to find someone who wants to swap, then that works great. The other thing you can do is you can do sort of work experience days, sort of taster days, I think they call them, where you sort of do the role of a junior doctor in that specialty. And I don't remember how many days, but there's a certain number of days per placement where you can make that swap. They can be a bit difficult to organize in practice, but the option is available. And then the other thing that you can do, which is a very common option, is a lot of people take an FY3 year. So it's now, it didn't, up until about 3 or 4 years ago, it wasn't really a thing that a lot of people did, but it's becoming more and more common over time. It's now the majority of trainees take an F3 year. So you do your F1, your F2, so that's your classic foundation program. And then essentially before specializing, you can do an F3 role where you work at the level of an F2 essentially, but you can pick and choose your placements. So different people do different things with it. Some people use it as a sort of extension of their elective, and they'll work abroad a lot and get that broader experience from working outside the NHS. Some people do a lot of locum shifts. I don't know if you're aware of what they are, but it's sort of filling in rota gaps that exist, and they tend to be quite well paid as a general rule, because if they're looking to fill rota gaps, they're a bit desperate. And that can be a great way of getting more experience as well. Or you can get sort of short-term roles, so you might get a role as a teaching fellow, or doing medical education, or doing research, or just working within a particular department as an F3. So that's another way that you can show your interest in the area if you didn't get it as part of your foundation placements.
Wow, I didn't realize there was this much variety after you just do your F1, F2. I thought it's because, again, we were told that it's F1, F2, and then you do your core medical training and you continue to specialize. I didn't know about all this variety until just now, really. You said you were an academic doctor, is that correct? So what does that entail? I've not heard of this much either.
Yeah, so the academic foundation program it runs alongside the normal foundation program. There's quite a few options. So there's your typical foundation program, and then there's your priority foundation program, which that tends to be hospitals that that junior doctors are less keen to work in, but you get other advantages as part of joining that program, and you get an earlier placement, so you know where you're going and what you're doing before everyone else does. There's also the Psychiatry Foundation Fellowship, which is relatively new, and that's specifically for junior doctors with an interest in psychiatry. That's an option. And you're guaranteed a psychiatry placement, obviously, amongst that. But you also get some additional supervision, and I think there's support to attend more conferences as part of that. And then there's the Academic Foundation Programme, which means that one of your 6 placements over the 2 years, usually in your second year, will be a research placement, or a teaching placement, or a leadership placement. So there's sort of 3 streams within it. They can be quite open-ended, or they can be quite defined, depending on which one you pick. So some academic foundation programs, or AFPs, have a sort of, they have a research project attached to them, or they have a teaching role attached to them, or they have a leadership experience attached to them that's already set before you pick it. Whereas some of them, so the one I'm doing is actually really open, it's just psychiatry research. So it's now up to me to choose what I want to do within that and to approach an appropriate supervisor and to work out a project with them that's feasible within 4 months.
That sounds really interesting. I never knew this was sort of a viable option you can do, because I was thinking, for example, personally, I would like to do practice medicine, but also do some research and, think about teaching later on. I mean, that sounds like a really interesting pathway. And the fact that they offer you that straight away is quite a good opportunity, really.
Yeah, it's really good. And actually for me, as soon as I heard about it, like you, I was sure that it was something I wanted to do, because obviously with my undergraduate degree and my master's, I already had quite an interest in research. And the other thing I'd been considering instead of medicine potentially was doing a PhD. And this is kind of, it means that I don't have to give up the research side of things.
So
it opens more doors. It's more fun than just doing standard 6 placements, for me at least. Some people probably hate the idea.
No, I think it sounds very, very cool. And also in the future then, do you think, I mean, if you're thinking about psychiatry, do you think you'll be half-time practicing, half-time research, or do you have any ideas?
I haven't decided exactly yet. So I'm still considering my options, and I'm going to see what happens, really. Perhaps this is how I'll spend my F3 year, deciding what I want to do. But I like a lot of different things. So I definitely know that I want research to be a part of my role in the future. And I would quite like to do a PhD at some point, but I don't know how much I want it to be a part, because I think, again, before I'd started F1, I underestimated how satisfying I would find the everyday jobs. I mean, even, for example, today, we had a patient on the ward who was really difficult to take blood from. And I managed to get blood out of a tiny vein in the side of her finger.
That sounds like such a victory, to be honest.
Such a victory. Honestly, you can be riding that high for the rest of the day. And, when you've done something particularly good on a night shift, if you cannulate a patient who's really difficult, or if you manage to get someone to calm down who was really upset, that kind of thing, that practical experience can make such a difference to your mood. And I think I hadn't realized how much I would enjoy those little victories.
Yeah.
So I definitely wouldn't want to give up clinical work for any length of time, because I do definitely enjoy it. But I do enjoy the research side of things as well. So we'll see.
That sounds great. I mean, hearing from you, it sounds like medicine's such an open door, basically. There's so much flexibility, so much opportunity. And this is mainly why I started the series, to actually learn from doctors as to what sort of different pathways they're taking, and learn about why they, took a certain option or why they went down a certain route. And so it was great hearing from you and learning about this sort of variety, which I never knew existed until just now. So thank you so much, Emma. It was really interesting to hear from you today. And I definitely learned a lot, which I will definitely be now considering going forward when I think of what I'd like to do in the future after I sort of hopefully complete medicine at a university. Oh, thank you very much. Thank you, Emma, for your time. That was really excellent.